So now let's talk about fractures. Fractures. So how just so what is exactly a fracture? A fracture is a discontinuing bone with overlying soft tissue injury, so like that. So now you have fractures. The patient coming from some kind of trauma. So they can be different. It can be pathological. It can be traumatic. It can be insufficiency. So a lot of things can be the cause for that. So now the patient is coming to you. So now the fracture patient. Now how can you classify? Now generally there are a lot of ways to classify the fractures. So it can be open, closed. Then based on the way the fracture is there, it can be transverse, oblique, spiral. What is compression? It's compression, like torus fractures. You might see that. Yeah. So those are different types. Closed. So that's one way to classify it. Now, so your investigations would usually be an X-ray, right? So you identify a lot of these things from the X-ray itself. Then based on if you need more further evaluation, you might go for an NCCT to get a 3D picture of what you're dealing with. Then you can go for then acute, which is immediately just maybe a splinting or plaster of Paris. Or you can think about external internal fixation based on the injury. I'm not dwelling into the depths of this. So now your fracture. You want to think about what are the complications of a fracture, because usually you have to go through the pattern of history, examination, investigations, and management, and then comes complication. So we have gone through them pretty quickly, right? But you have when you go through them a lot, you can go through them really quickly. Now come to complications. So complications, what are the complications of fractures? So again, we have open fractures, and open fractures have their own classification, and they have they are very important management. So that is the entirety in its own, right? So that's a separate heading. So here now, what are the complications you can have when you have a fracture? Again, it's best to have some kind of a categorization of whatever you're going to tell. So early you might have some kind of pain. Pain is obvious. I mean, history, I mean, the complaint would be the pain is pain, swelling, reduced range of motion, deformity, loss of function. So it's pretty much similar to the inflammation signs which you'll find. So now the complication, yes. So severe pain, there will be some kind of you have to be on the lookout for compartment syndrome. Then there can be, if it's a long bone fracture, you can think about fat embolism. Uh, then crust, crust syndrome, where the cells of myoglobin, excess myoglobin, because of increased damage to cells, you can have something like a crust syndrome. Then yeah, then based on the again like, based on the type of bone, you can have a lot of bleeding. If it's a femur, about 2 liters. Then if it's a hip, you can go about 2 to 3 liters of blood. So those things, and it's because fracture is closed does not mean it is. Then I mentioned that neurovascular structures. I think I already told that. So this is the complications. So we have talked about history, investigations, management, complications. So this what so again, this is something early, right? Again, we talked about. So these are most of the things that are early. Your patient comes, so these are the things you will find early, and you have to be on the lookout for. And what about some other complications that might come later on, like if it is not handled properly? Again, non-union, malunion, deformities. So and yeah, those are your long-term complications.